I'm Sue Rabati, and I'm the founder of MedShadow. And welcome to MedShadow TV. This is
Jonathan Block. I'm the content manager here at MedShadow.
Today we're going to talk about prostate cancer. Prostate cancer, of course, only affects men, and the United States Preventative Services came out with new guidelines on who should get the test for prostate cancer. Now, the test for prostate cancer is called the PSA, and it's been controversial for quite a bit of time. Can you tell us why?
Yeah, the reason is that this PSA test, if you were to get it and you get a positive reading, it could lead to you to a man getting either a biopsy, which has side effects in and of itself, and or getting radiation or even surgery, both of which have side effects. And the thing is that one may have prostate cancer, but it may never spread or grow, and it may never become life-threatening or come to the point where you need any of those potential procedures. So a lot of men are getting unnecessary procedures when the prostate cancer may not spread or become severe enough that would actually warrant that.
So there are actually two issues with the prostate cancer test, with PSA. As you said, there's the issue of false positives.
Correct.
There's a very high level of people would be told that they quite possibly have cancer based on this test, and then have to go for the additional testing only to find out that they don't have it at all. And then there are the people who do test positive for the PSA, and in the biopsy it's confirmed that they have cancer, but there's no way to know if it's a fast-acting, a medium-acting, or a what they call an indolent cancer that goes very slowly, that grows slowly. Most of the prostate cancers are what are called indolent cancers, but you don't know. So most of the people who are diagnosed with prostate cancer will probably take some action. They'll probably go further for radiation and chemotherapy, which quite often, 60% of the time or more, ends up with a certain level of incontinence and erectile dysfunction problems.
Correct, and you had mentioned it at the top about the U.S. Preventative Services Task Force, where before they were recommending against having a PSA test, they did kind of an about face, where now they said if you're between the ages of 55 and 69, you should talk with your doctor about getting one, and if you're 70 or older, you should not get one because the risks associated with what would happen after the PSA test are not worth it. You had mentioned some of the severe side effects associated with some of the treatment. For example, if you were to get surgery or radiation as a result of a positive PSA test, about 75% of the people who have that tend to have serious complications, which you mentioned are incontinent or erectile dysfunction. There's a great little infographic that talks a little bit about the benefits and the risks of getting this PSA test. And one of the things that I think is interesting is that if you look at 1,000 men who go and get a PSA test, out of that 1,000 men, the PSA test will only end up benefiting 3 men by having them avoid cancer spreading, and it will only help 1 to 2 men avoid death from prostate cancer. What does this mean? It means that a lot of men are, from the PSA test, are getting the test and then getting treatment that really doesn't have much of a benefit, but as we mentioned, has those serious side effects such as incontinence or ED. So the thing is that you have this test and relatively few men will actually benefit from it, which is one thing that you should take into consideration if you decide to talk with your doctor about getting one.
It comes down to 1.3 men. 1.3 lives will be saved out of 1,000 PSA tests, which is not considered a very positive risk-benefit ratio, considering the risk of side effects.
Exactly.
However, if you are diagnosed with prostate cancer and do choose to go the radiation route, there is a new study out, just came out last week, in the International Journal of Radiation Oncology and Physics that indicates yoga is quite possibly of real benefit to those undergoing radiation. This is a very small test. There are only 50 men who actually participated in it.
That's 50, not 15. Just in case it didn't get clear, but it's 50.
Thanks. And it covered the 6 to 9 weeks of radiation. About approximately half the men were also asked to take yoga classes twice a week, and half the men did not. And they found pretty convincingly that those men who took yoga while undergoing radiation had less extreme fatigue, had somewhat better, how does one say, less incontinence, I should say, and fewer problems with erectile dysfunction. So if you find yourself going down that path and ending up in radiation, yoga is something to consider. I did speak with one of the doctors, one of the scientists who ran the test, and asked if you could draw a conclusion from this study that anybody undergoing radiation for cancer should consider yoga. And he said, while the study was not designed to answer that question, it was certainly a logical conclusion, and that they were preparing for future studies to study exactly that possible benefit. So think carefully. Obviously, if there's a family history of prostate cancer, that might change your decision. Your doctor should be able to give you a lot more information, but consider the risks and the benefits.
As always, which is what we talk about here at MedShadow all the time. Thanks very much for joining us, and have a great day.
Come to our website at www.medshadow.org.
Take care.